our organization doing. And so now, okay, you started the recording. Okay, I'm pressing okay. And so, anyways, this is technology is so fun, isn't it? And so hopefully you'll be able to hear and I'll be able to share with you what she was hoping that I would be able to do. And so I know what's going to happen here is I'm going to share, you're going to see the screen, then I'm going to press another button and then you won't, and then I'm going to press another button and then you will.
Okay.
So just be prepared. Here we go. Let's try with the share first. Oh, okay. Now I guess you do have to let me share because now it's not going to let me share. I'll send a request. So you have to let me share. Okay. Now here we go. Okay. So now we're on this screen and I'm going to go play from start and then it's going to stop. So just 1 minute more. Okay, I think we've got it, right?
Yes.
Oh, all right. And you can hear me, I presume?
Yes.
Okay, so this is the topic, and just as a reminder, or for those who haven't heard me, when I have been there before, our organization has been around since 1998, so well before COVID, and our mission is to protect patient and doctor freedom. So that's our mission right there. And so I thought what I would do today, before I really started on the 3 topics that she wanted me to talk about, I would give you 3 of the main truths that we sort of operate under. And that is that the mission of medicine has been taken over by the business of healthcare. And if I could, see you better and see your faces, I would probably see people shaking their head because you probably know how this feels in the exam room, how it's not quite the personable or personal relationship and time in that exam room that you used to remember. Truth number 2 is he who holds the data makes the rules, and every tyrant knows this, which is why they conduct surveillance on their people. And then the third truth is that privacy is the foundation of freedom. And so if you can protect privacy, your right to hold your data private, only share it with those who you want to share it with, you will protect your freedom because they will not be able to track you. They won't be able to watch you. They won't be able to profile you to figure out who you are and how you will respond. They won't be able to influence you in the same way. So those are the 3 truths. Now, I'm going to be talking about health surveillance primarily, and then we're going to end with Medicare. But the health surveillance that I'm going to talk about is Real ID, HIPAA, and the electronic health record. And now I just want to make sure, because I can kind of see you out there, is everything working okay for you can hear me?
Yes.
Okay. All right. Good. All right. Okay. So let's talk about Real ID. And this is the hot issue of the day, although for a lot of people it's not, because they don't actually know what Real ID is. So Real ID is a federal ID masquerading as a state driver's license. Now, if I asked you to take out your ID now or your driver's license now, the real question is, will you find a star? If you find a star, it is a federal ID under federal control, issued really through the mandate of the federal government, because the federal government told the states that if you do not have, or if they do not conform to Real ID, that they would not let the people in your state, in the state of Missouri, fly. And so on the basis of that, legislators caved and conformed with the Federal Real ID Act. Now, you see this license over here from South Dakota, and you can see the star in the corner. If it was not a Real ID, if it did not have a star, it would say something like, in words close to the word South Dakota there, it would say something like, not for federal purposes or not for Real ID purposes. So here are some Real ID realities. It's unconstitutional. It is a usurpation of states' rights. And in 2017, 116 state legislators from Pennsylvania wrote to President Trump and said exactly that. Real ID is a usurpation of states' rights. It's a violation of individual privacy rights. I have the letter. We have the letter. It's up on our website, but to our knowledge, President Trump never responded. So right now, you probably know that Real ID is required for flight, although it's not really required for flight, and I will tell you about that. But that is the assumption. That is what the news has said, is that it's required for flight. And so I think you need to know what the law says. What the law says is that the Real ID is required for access to federal buildings, access to nuclear facilities, and access to commercial flight, and any other purposes that the Secretary of Homeland Security, one bureaucrat, shall determine. And so thus, once they get everybody to have a Real ID because they think they need it to fly, then they can just expand the other required uses, such as for access to healthcare. Because you might wonder, why is a health policy organization in the Real ID space? And actually, we're leading the charge in Real ID. And if it wasn't for us, there probably wouldn't be a campaign, is what some woman in a X space said when she introduced me. There wouldn't be a campaign against Real ID, but we fought it in 2008, 2009, 2016, 2017, and I feel like we know more about this issue than probably any other organization in the entire country. So, and we believe that healthcare will be what they would next put as a required use, because it would force everybody into Real ID, because not everybody has to fly, but everybody does need a doctor, or they do need access to the hospital. So anyway, so future restrictions could be whatever, the sky's the limit, whatever the Secretary of Homeland Security, currently Kristi Noem, would decide. So it could be healthcare, buying a gun, opening a bank account, going to college, paying your taxes, renting a car, renting a hotel room, you name it, the sky's the limit. Another reality is that it's moving towards a digital ID. Now, I can see you. So how many of you have heard about what is happening in the UK now with them mandating a digital ID, or they will not be able to work? How many have heard this? Okay. Some of you have. This is exactly where this is going. And you know, in the UK, people are in the streets. They're protesting in the streets. They've got signs. There's hundreds of thousands of people because they see the end of their freedom and they see the end of their privacy. And so this is a Real ID is a digital ID with remote access by the government. So the DMVs have testified to Congress, the state DMVs have testified to Congress that they are digitizing the Real ID, putting it on people's phones, and having remote access to it. And their anticipation when they talk to Congress is it will take a few years to get to 100% digital, but that is exactly what their plan is. And so Americans are not rising up because Americans don't understand the Real ID for what it is. The Real ID also requires a biometric, starting with your facial geometry. So the government is building a facial recognition system using this biometric requirement that your face, a digital version of your face, be in the Real ID. And what that means is the government has decided that it has the right to collect and catalog the coordinates of your body for its control and for its surveillance and for picking you out of a crowd. I don't know if I say this further on in this presentation, but when you go to the airport, do not stand in front of that camera, because they are really, I believe they are training the machines, training the computers to be able to pick you out, not only from whatever picture is on your license, but as you stand in front of them with a different hat, with a different haircut, with glasses, with sunglasses, with whatever you have on your face. I believe they are training the technology. And then the last thing is we believe it is building a framework for a social credit system here in America, and actually also a carbon credit system here in America once it's digitized. So we're not going to let it get digitized. What you have to understand is this is a domestic passport, federal control over all areas of your life, controlling transactions, movement, access, any kind of access you can think of, access to a building, access to your bank account, access to all sorts of other things in your life, transactions and movement. Here is the law, because I really wanted you to see that this is actually what it says, any other purposes that the secretary shall determine. So it's within the definition section of the Real ID Act. And so it says accessing federal facilities, boarding federally regulated commercial aircraft, entering nuclear power plants, and any other purposes that the secretary shall determine. And the secretary does not have to go back to Congress or to the president, because this is a law. It's not even a regulation. So, as I said, we believe that healthcare will, this is why we're in the space, not only for freedom for the entire country, because I'm totally all about freedom, but just also that it'll be no card, no care. And this will be a way to force everybody into this digital ID system, biometric controlled. Now, here is a database you've probably never ever seen. And it was started, it's run by AMVA, the American Association of Motor Vehicle Administrators, all the heads of the DMVs, essentially, around the United States, but also in Canada and some other places are all part of AMVA. And so they created this SPECS database, and SPECS stands for, oh shoot, I can't see my own notes. But it's something like state. They're a state pointer exchange system database. So if you're in Missouri, you decide to move to Minnesota, you want to get a Minnesota license, you go into the DMV and they go into this. They go into that little thing, that little specs thing in the orange square, and they check to see if you have a license anywhere else in the entire country. And then, and if you do, they invalidate it before they will give you, they invalidate your Missouri license before they will give you a Minnesota license. And so AMVA set this up. This is all federally funded. AMVA believes in one license, one driver, and a lot of state laws require you to have only one driving credential, which I think is very interesting, but it's true. So now we're just going to go to the thing that you probably think about Real ID, which is that you can't fly without it. But this is not true. This is you can't fly is a lie. So there are 16 different IDs that are TSA acceptable. One of them is the Real ID. Passports, passport cards work. I'd encourage you, when you get the passport card. It's just the same size as a driver's license. It's the easiest thing to use, and it will let you sleep at night. If you choose not to get the Real ID, which I certainly hope that you don't. But if you're ever worried about flying, just get the passport card. It's also a lie because Homeland Security is under a 2-year phased-in enforcement period ending on May 5th, 2027. Now, Kristi Noem hasn't said a word about this, to my knowledge, unless she mentioned something when she was in Congress testifying before them, but she's not telling the public about this. And this progressive enforcement rule is there because they were so concerned about what would happen at the airport if they just put the hammer down on May 7th of this year and said you can't fly without a Real ID. So this is probably the 7th extension of the deadline for all of us to have Real ID, and we intend that they will never accomplish their goal. And we have actions for you to take to make sure this is true. The other reason this is a lie is because you can always submit to screening at the airport. Now, this has always been the case. I wonder if there's any of you, I'm looking at the picture now of y'all, has anybody ever lost your ID or had it stolen and had to fly anyway and got through the airport? Anyone?
No hand.
I see no hands. Okay, well, I have. Lost it at the airport, and they sat me at a little table. They picked up a phone and they started asking me questions like, so what was your first email address? What was the color of your first car? What was the address of your first home? And they have all of this. And this is how they check to see that I was who I said I was. And so this will always be the case. Even if everyone were to succumb and submit, and we all had Real ID, we would lose it. We would have it stolen. And there's always a way to fly. Now, here is the chief propagator of the lie. This is Kristi Noem. And on April 11th, so this is from May 7th, but on April 11th, she came out with a video that you see at the airport all the time and elsewhere. And it says, if you arrive on May 7th at the airport, you will not be able to travel. Now, mind you, I've just told you all the reasons why you can travel without a real ID. Then she testified on May 6th to Congress, where Congress said, so if people don't have a real ID, they won't be able to fly. And she said, oh, no, we've got security procedures for that. So no, we will make sure that they reach their travel itinerary. But then the very next day on Instagram, she sent out this one. Starting today, May 7th, you will need a real ID to fly. So, I do not know why Kristi Noem is pushing this, but this is, this is tyranny, essentially, what we are talking about here. And she is head of trying to convince us all to lose our sovereignty, individual and state sovereignty. This is where they are going, so that your body is your ID. This is from Clear, but this is where they're going. They want everybody to be identified by your biometrics, by your eyes, by your gait, by your palm, by your DNA, by your face. All of these things are biometrics that you could be identified by. Now here, the head of the Department of Homeland Security in 2007 said in a speech, we are starting the process of biometrifying a good proportion of the world population. So this is where globally it's going. But you need to understand about the Real ID. The other things here on this list are the fact that we believe that the Real ID will end up being the vaccine passport if we don't have enough resistance by the public. We believe it will be the unique patient identifier, the UPI for your medical records. And we believe that it will hook up with a global digital identity system because they're all working together to digitize. And you see it now in England, where the press is on, where they're being told they can't work without a digital ID. So here, I want you to see IDEMIA, because IDEMIA is seeing you. So IDEMIA runs the TSA checkpoints at the airport. And if you the next time you fly, just look at all of the equipment that is sitting around the TSA agent. And you will see the word IDEMIA. IDEMIA is a French company, and their plan is augmented authentication so that you never have to show a paper. They have your biometrics, they have your eyes, they have your face, they have your gait, and they know who you are, from a distance. And TSA has a $46 million contract with IDEMIA. And IDEMIA used to do TSA PreCheck, but now Clear is doing TSA PreCheck, but it's all moving in the same direction of we will all be biometrically identified, no privacy on the street, nobody anonymous, and this is part of the reason you have to understand what the Real ID is. It's moving us in this direction. So our call to you is if you have a Real ID, make the switch. Go back to a state driver's license. Now, there are 5 states that won't let you do that. They're all Republican states, Georgia, Florida, Texas, Wyoming, and Mississippi. The rest of the states allow you to go back, although some, I don't know if it's rogue DMV agents or it's regulations, that they will not let you switch back once you have changed. But others, it's easy peasy, as somebody in California told me. And Minnesota, it's easy as well. So wherever you are, if you happen to be visiting outside of Missouri, go back and make the switch. 44% of all cards are not Real ID compatible, compliant. And so we want to change that to 46, 47, 48, 50, etc. And now if you go to Refuse Real ID, which is our special website for this, we actually have, if you go scroll a little bit down the page, you'll see a map where we are asking people to register that they have made the switch. And we are building the momentum to get people to switch back. And you have to do it as soon as possible. Do not wait for your next period to come up to to get a new ID because rogue DMV agents are likely to make it really difficult for you to make the switch. So you need to do it now. So refuserealid.org is our special website for this initiative. And here are some of the things that you will find there. There's about 8 documents, including the fact that we wrote a letter to President Trump and told him basically he's got to stop this. and and then we got a letter back from the TSA that said the White House has referred your letter to us. So on this website, you can see all the redlining that we did on the TSA letter where we told the truth compared to what the TSA told back to us. And we have these little cards, and if I were there, I'd be passing out these little cards. They're just business-sized cards that you can, share with anybody. And you can find them at Refuse Real ID, and you could certainly give us a call and order some. And I was on the Dark Horse podcast talking about the truth about Real ID in July. He's been podcasting for 8 years, and right now it is his 10th most popular podcast. It just moved into 10th spot today. I think we might be able to get it up to 7th or 8th. And then the whole country will have to be really outraged and understand what's happening for us to get it any higher. But you can see that the interest in this issue is very large, and people realize that they have been misled about what Real ID is. And I think it's tomorrow where I will be for the second time on Jimmy Dore, and Jimmy Dore's broadcast has had almost 700,000 or maybe almost 800,000 views. So we did have a few billboards. And we really want you to share this information with everybody on social media because that's how we're going to get the truth out, because the news doesn't want to talk about it and everybody thinks it's a done deal. They think that the horse has left the barn. That's what I've been told. And I'm like, if the horse has left the barn, then our nation is in really big trouble. We need to be doing exactly what's happening in England where they are refusing this card. Okay. Now, Jane asked me about HIPAA too, so I'm just going to quickly go through HIPAA. Some of you, I'm sure, have heard me speak when I have been there, but some of you probably have not. Many of you probably think that HIPAA protects your privacy, and it does not. What is HIPAA? It's a 1996 law, 2003 rule, and it is actually a rule for permissive data sharing. No consent is needed. There's 2.2 million entities that can have access to your data without your consent, and it also allows your data to be digitized and put online without your consent. I wrote an entire book about this, Big Brother in the Exam Room. It's gotten 8 awards, and we're on our 4th printing. If I was there, I'd hand out a few or make them available. The other thing that has made your data so available is the electronic health record. So the electronic health record was mandated within 4 weeks of President Obama being his first election. It was inside the Recovery and Reinvestment Act. Remember that shovel-ready projects act that happened? Well, inside of there was an act called the High Tech Act, mandating that every doctor and every hospital have an electronic health record. And I'll just say one more thing about this. This is the government version of the electronic health record. So we call it the government EHR. It's got to be certified by the government, and it's got to be used for what the government wants it used for. And so those who refuse the government certified electronic health record or refuse to use it meaningfully are financially penalized. And if you think that word meaningfully is just like, just a kind of a fluffy word, no, there are 3 meaningful use regulations. And most of them have to do with your doctor sharing your data above or far outside of the exam room to the government and others. Doctors lose 3% of their Medicare reimbursement for every Medicare patient or every Medicare procedure that they do if they fail to demonstrate adoption and use of this electronic health record. And hospitals, if they get a raise in Medicare payments, hospitals that refuse only get 25% of that raise. They lose 75%. So this was meant to put all of our data in a digital system where it could be readily accessed by everybody who wants to use it to control the doctor, profile the patient, and decide what you can and cannot have according to the data that's been collected on you. So The fact is that the electronic health record is not a medical record. It's used for many things, but according to Dr. Scott Silverstein, it's an enterprise-wide command and control system through which all medical transactions have to pass, controlling electricians, that's very good, Twila, clinicians, and clinical resources. And so it's all about controlling the doctors and controlling what you can and cannot have. Now, prior to the HITECH Act, only 10% of hospitals had EHRs. And part of the reason they didn't have electronic health records was because it was way less expensive to have paper and charts. But because they now have been forced into electronic health records, the entire healthcare industry has been consolidated. Most doctors, about 80% of doctors, have now become employees. They could not handle the costs. And in my book, I talk about all the different costs, a pen and paper. Really simple. They didn't have to have cybersecurity. They didn't have to have regular updates to these systems. They didn't have to have training. They didn't have to have, additional staff just to run the whole record system. And then a lot of small hospitals merged into larger hospitals, and a lot of rural hospitals are gone. So they not only facilitated consolidation or led to consolidation, they facilitated automation. So physicians are being replaced with non-physicians. And, physicians have a lot more training, a lot more training than any of these non-physicians, but non-physicians can follow the protocols in a computer, and often without questioning it, because they don't have all of the additional expertise and the training and the experience of a physician. So for a hospital or a healthcare system, it can be less expensive for them to have a non-physician who will simply follow the protocols that have been put into the electronic health record, into this command and control system. And then, of course, now they're moving to AI, replacing all types of clinicians and just telling you basically what you can and cannot have. And I don't think I have a slide, no, but I'm just going to tell you that there is a congressman in Arizona, Schweikert, who has a bill to make artificial intelligence a provider, an actual, put it in a law, that artificial intelligence becomes a provider so that this provider can provide prescriptions without anyone having to go see any kind of a real doctor or a real clinician. So, but here's a funny story from this person who I don't know who this person is, but it was on Twitter, where this person said, "I remember the stunned look on my primary doc's face when I told her no one had asked my permission to put my personal medical records online and demanded she keep a paper file only on me." So you haven't even probably looked at this entire system as a violation of your privacy rights or your individual choice over medical care rights, but this is what it is. And because of HIPAA, this is how your data is shared. Now, this comes from the Data Privacy Lab at Harvard University. And in my book, I have the one that's pre-HIPAA and has only about 9 orange dots. And this is post-HIPAA. So the sharing is, as I said, it's permissive sharing. And that's also because of the electronic health record that, it's so easy to be shared. And out of the electronic health record and HIPAA, which allowed everything to be digitized and shared without your consent, out of that has come the eHealth Exchange, funded by the federal government. This was the initial view of it from HHS back in 2010. This is how they envision this nationwide health information network. The red is the internet, and all those blue things are the nodes where people connect into the internet, and off to the, let's see, I guess it would be your right, I think, are all of the federal agencies that are connected into this grid, sharing all this information and being able to access it from around the world without your consent, because HIPAA doesn't require your consent. So this is how it looks now. The eHealth Exchange is the former nationwide health information network. This is how it looks now. And they call it the largest health information network. And of course, they say it's dedicated to the public good. I would disagree with that. But it's considered a network of networks. So there are private networks, there are state health information exchanges, and then there's this big eHealth exchange, and they all get connected together in the eHealth Exchange. Now, not all of them are in, and I haven't looked up Missouri. So you can look it up at eHealth Exchange. You can just go in there and see who are the participants, and they have it by state, and they have any of the entities that are in your state that participate. There are 34 states that have entities inside them that are participating, and you can see there that there are 5 federal agencies that participate and 75% of all hospitals. Yep. Did this do it? Yeah. Okay. So you really need to protect yourself from HIPAA. So I'm just going to cruise through these. Ask for a real state medical privacy law. You have to ask this of your legislators, and we are happy to work with your legislators because we've got model legislation to do this. Minnesota has the strongest medical privacy law, state medical privacy law, and it really bugs people who want to be under HIPAA and not our law. And so ask for a real state medical privacy law, but your legislators think HIPAA protects you, and so this will be news to them. Refuse to sign the Notice of Privacy Practices Acknowledgement Statement. I'll say more about that in a moment. Guard what you say in the doctor's office. Realize that the eHealth Exchange is in the background, and if you have a scribe, tell the scribe to leave unless you don't care about what you're going to say, and then just be careful about what you say. And then if there's a virtual scribe, recording ambiently in the room without a person, but just recording every word that you say, tell the doctor to shut it off. This is how they are relieving the paperwork burden of the electronic health record system, is by putting these virtual scribes, first the actual physical scribes and now virtual scribes in the exam room. And you have a right to tell them to leave. And then you can revoke consent as you leave. If you go to our patient toolbox, which is at patienttoolbox.org, we have several places in there on consent forms, and we give you a revocation form, and you can just hand it to the staff on your way out. Revokes any kind of consent you felt you were forced to do. You can pay cash because in the federal law, HIPAA law, it says if you pay cash, they can't share your information anywhere, and you can tell them, I'm paying cash, don't share it. You can find a doctor in the Wedge at jointhewedge.com, which is our online directory of cash-based doctors. Here you go. So they don't take government and they don't take insurance. They take only cash and they work only for you. Now, to just figure out how to refuse to sign the HIPAA form, I want to just tell you this. The important reason to refuse to sign the HIPAA form is because, one, you have a right not to sign it. Then no law requires you to sign it. And a matter of fact, HHS says you don't have to sign it. And so one of the things that you do is you tell the staff that you understand what the law is, and they're going to tell you, but this is all about privacy. Protect your privacy. No. The acknowledgement statement says, I understand, I have read, or I have received the Notice of Privacy Practices. And if you have actually done that, and you've actually read it, you will know that it tells you all the ways that your data can be shared without your consent. So it has nothing to do with privacy. It's a ruse, getting you to sign it, getting you convinced that this has anything to do with privacy. So don't be part of the ruse. Stand up, refuse to sign this thing. And this particular form right here, our discharge instructions, has 6 ways to refuse HIPAA, starting with number 3. So we've got 6 sections in this form, and you can see number 1 and number 2, but when you get down to number 3, it will tell you how the 6 different ways for you to refuse HIPAA. And whether you sign it or not, they can share your data unless you have a stronger privacy law. But you are because we have had people refusing for probably the last 15 years, we have seen the farms start to switch. We've seen them starting to let you refuse to sign without denying you access to care. So I'm going to show you, this is the most ridiculous way that they ask you to sign. They say, just sign that. And you say, well, what is it? And they say, it's that HIPAA form about privacy. Okay, and then my question to you is there anything else that you sign without ever seeing it that's a legal document, and you just take their word? And how many words are in there? Well, what does that actually say? So I refused to sign this, and I said, give me the piece of paper, and then I will decide if I'm going to sign it. I want to see what's all on there. It could be a massive consent form and only that one little acknowledgement statement kind of buried in there, which I will cross out. And then I might even refuse to sign the entire form. Anyway, this is the very best way to refuse to sign. So this is what you can find on your phone. And I go into the exam room or the clinic, the hospital, and I put this on my phone. And if you get this, this right here, it tells you how to find those words on your phone. And it's the HHS website on the Notice of Privacy Practices. And this is what it says. The law does not require you to sign the acknowledgement of receipt of the notice. Then you'll notice the last bullet point. If you refuse to sign the acknowledgement, the provider must keep a record of this fact. You do not have to lift a pen, click a button, write the word refused and initial it, nothing. They have all the work to do. And ever since I have started putting it on my phone and just putting it in front of them and saying, I don't sign HIPAA and here's why. See bullet 1, see bullet 4. Then they're like, they don't know what to do with that. So so I've had great success. Okay, now we're going to switch to Medicare, and then I know it's some questions, right?
Yes.
How am I doing on time?
Oh, you're fine. You're
fine.
great. You've got 50 minutes.
Oh, okay. Well, I love questions. So I love to answer questions. So anyway, we'll get there. So Medicare open enrollment has started. Some of you are in Medicare already. Some of you are having to consider it in your future, and some of you have family who are having to deal with this issue. They're either in it, they have to make a decision about it, etc. So we wrote this guide, the Medicare How-To Guide. And I had someone from Trump 1 Medicare administration who said that this is a service to the American people. And he said there are things in here that people will not find anywhere else. And I have to agree with that because it took a lot of research to pull it together, including listening to videos from independent Medicare agents. That's an important word, independent Medicare agents. Now, if you put your phone up to this QR code, it will take you to this Medicare guide. And at the end of this Medicare section, I will pull up this slide again, and you can do this. But just, it's not small, but I have somebody once told me that they gave it to their neighbor. Their neighbor came back a few days later and said, okay, now I know exactly what to do. And this is a very important decision for you. And if you make the wrong decision, sometimes you will not be able to change your mind. And so we talk about the 10 Medicare traps in this guide. So I'm going to go through those Medicare traps for you and then just share some other things that are in this guide. So the Medicare program itself is a trap. There's no escape from it. So you are suddenly in a government program which is beholden to a congressional budget and anything that Congress decides to do. And so when you turn 65, you are suddenly senior. Imagine if we did not have Medicare. What would be turning 65 be like? Nobody would think of you as anything different. You just gained another year. But now you are suddenly senior. In the eyes of the law, your entire position has changed. And you are dependent on the federal budget, which has a looming insolvency in just 8 years, according to the latest trustees report, 8 years, before it will not be able to pay all its bills. So the expectation is it will only be able to pay 89% of its bills. You are corralled into it. You will be. The Medicare agents will try to corral you into free Medicare Advantage. And I will tell you, and I made it very clear in this guide, that we encourage you not to go into Medicare Advantage. And then of all things now with Dr. Oz, and the reason about Medicare Advantage is because it has prior authorization. Original Medicare does not. Your doctor decides you need something, you get it. And Medicare Advantage, You have to go through the hoops, prior authorization, delay, denial, all sorts of things. But now, because President Trump has taken Dr. Oz in as head of CMS, I am sure this is why this last bullet point is happening. Dr. Oz is a supporter of Medicare Advantage for all. And in a paper that he wrote with the health plan CEO in 2020, he said that this was the solution to healthcare in this country, that we would all be in Medicare Advantage run by the health plans. And everyone who wasn't in Medicaid would be in Medicare Advantage. And we wrote a letter to President Trump. I signed a letter to President Trump, and I said, do not choose Dr. Oz, because he wants a single pay, he wants a socialized system. He wants us all in government health care. So now, because he's such a fan of health plans, which ration care, deny, delay, do prior authorization, CMS has just added prior authorization to original Medicare starting January 1st in 6 states.
Oh, no.
Now, I didn't look this up to see if Missouri is one of them, Arizona is one, Texas is one. I can't remember what the other 4 are, but it's coming, and he wants it in absolutely every, he wants it across the entire board, and he's probably going to use his 4 years to try to make that happen. So even though you're paying more money to be in original Medicare, he's bringing in a third party who will be paid for every time they find something that they have denied as medically unnecessary. So they're bringing rationing into original Medicare. And and Schweikert, I mentioned Schweikert before, who wants us to have AI as a provider. He's got a bill to lock everybody that is newly going into Medicare, to lock you into Medicare Advantage for 3 years. And there would be some opt-out period, but it's not entirely clear how. And of course, it would be a burden. They would just put you in Medicare Advantage, and then you have to take the time and the effort, and you have to figure it out that you've even been in there. And if you miss the deadline for getting out, you're locked in. So as I said, Medicare Advantage for all from Dr. Oz. And you are trapped in there because there's no Social Security if you refuse to enroll in Medicare. And then the other thing to know about, again, this is all about Medicare itself being the trap. If you refuse to enroll in Medicare, you don't get your Social Security benefits. That's something that the Clintons did. And if you are in Medicare and you decide it's a really bad deal and you want to get out, you, according to what the Clintons put in a handbook or in a program operations manual, you will have to pay back every dime of Social Security and Medicare that you have received to that point. Not a law, not a rule. None of this is a law or a rule. They just did it, and nobody has undone it. The other thing about Medicare is if you're still working, you'll have to pay more. But we are trying to change that. We are doing 2 things, which you see here: the Retirement Freedom Act, giving seniors the right to opt out of Medicare without losing their Social Security, and then acknowledging and looking at Medicare as an act of age discrimination. Because when you turn 65, suddenly you cannot buy real health insurance. So, and Medicare controls everything that happens in healthcare to everyone in healthcare, controls every doctor, except those who are in the wedge or are completely free. So it's really important to get freedom from Medicare. Medicare is in trouble. If you look there at the red line, that's where it shows 2033, where it runs out of money in the so-called fund. But what this really means is that they will only be able to pay the bills as the money comes in from workers through the payroll tax. And so they expect that 11% of all bills will not be able to be paid, and who will eat that cost? All right, the second trap is there's no other coverage options. As I was saying, you have to go into Medicare. But it's really good to just sort of like look at this in the face. The health plans, they offer no coverage at age 65 unless you go into Medicare Advantage. If you fail to enroll in Medicare, it leads to these penalties. Not just that you don't get your Social Security, but if you come in later, there are lifelong financial penalties for you to stay in Medicare. Employers are allowed to shift older employees to Medicare as responsible for the bill, even though you're still working. Medicare is going bankrupt. And as I said, this is age discrimination in action. And a lot of people really like this because they were part of the Ponzi scheme. You all might be part of still the Ponzi scheme, right? Where it's still paying your bills. But nobody ever paid enough to pay for all the Medicare that they're getting. You get about 3 times as much Medicare as you ever paid for, which is why it's going bankrupt. Trap number 3, financial penalties for delayed enrollment. So here they are, in case you've never seen them. If you choose not to participate in Medicare Part A or delay enrollment, it's a 10% penalty times twice the number of years that you refuse to enroll. Medicare Part B, it is 10% for every 12 months that you refuse to enroll, and it is a lifelong penalty. And Medicare Part D, it is a 1% per month. So not for 12 months, but per month, 1% per month, and that you were not enrolled when they think that you should be, and that again is a lifelong penalty. Trap number 4, Medigap rule restrictions. So Medigap is actual insurance or closer to insurance than Medicare itself. And these are the health plans that provide you the coverage to pay your deductible, to pay your co-insurance, to pay anything that original Medicare refuses to pay. Now, a lot of people think that original Medicare just like covers everything, but it really doesn't. After 180 days in the hospital or a facility, sorry, I'm looking at something wrong here. I think it's after 150 days in a facility, it quits. And all the costs are up to you unless you have supplemental insurance, supplemental Medicare or Medigap. It has 2 names. It's only available for people in original Medicare. If you're in a Medicare Advantage plan, this doesn't even pertain to you. But you have to make this choice very carefully because you have only 180 days after Medicare Part B decision has been made to choose it without the insurers being able to look at your entire medical history, quiz your doctor and everything else, and just choose that, nope, we're not going to cover you because you got too many problems and we're not going to pay for them. And then I just reminding you of Schweikert's plan to lock people out and put them in Medicare Advantage. Okay. Trap number 5, hidden Medigap traps. Medigap Part N is really only available in the first 6 months after you choose your Medicare Part B. After that, they will medically underwrite you. And even if you lose your plan, even if you are under guaranteed issue because your plan has gone, your Medigap, your supplemental has left the market, it's gone. You can usually go into any other plan without medical underwriting, but not Medigap Plan N. So if you want it, it's a very unique plan. You have to make a decision fairly quickly. You can be priced out of Medigap as costs arise. I know people who were in Part F. It was the best one that there was, and now they're out of it because they couldn't handle the costs. And so if they have many, many days of hospitalization, they might be on their own for covering the costs, or they'll have to leave the hospital. As I said, other Medigap plans, they may tell you no because they just look at you and say you're too expensive. You're out of that, 180 days, and so we don't have to say yes to you. And then if you're in a Medigap plan and they close it, nobody else can come in it. It's a death spiral. It's a closed book of business. As people die, the number of people in that plan get fewer and fewer and fewer, and they raise your price higher and higher and higher. And you cannot just go to another one without medical underwriting until they actually shut down. So all of this is in the book, Medicare Trap 6, Medicare Advantage Organizations. This is again Dr. Oz. I just want to show you evidence that he actually wrote this. And this says by Steve Forbes, but this is Steve Forbes. It is Forbes magazine who is actually publishing this. And Dr. Oz wanted to pay for all of this by using what he called an affordable 20% payroll tax. That's how he's going to pay for Medicare Advantage for all. Unfortunately, Heritage Foundation has a bad idea here in their Project 2025. They too want to make Medicare Advantage the default option in Medicare. We did send a letter to President Kevin Robbins at the Heritage Foundation, but never got a response. And here are some of the dangers of Medicare Advantage. It can legally ration care. The health plans were made to ration care, and Medicare Advantage is health plans in Medicare. So Medicare Advantage is actually rationing Medicare. There have been there have been 3 reports since 2015 talking about how they ration care and how often they ration care, and they basically wait to see whether you have the wherewithal and the ability to appeal it. And if you do, 75% of the time, they will overturn the decision. But these federal reports found that only 1% of people who are denied access to care ever appeal. And it's because it's a very burdensome process, which I'll show you in just a moment. Anyway, these Medicare Advantage plans have networks, prior authorization, and step therapy. These are ways of rationing care. It's also ripping off taxpayers. That should say Medicare Advantage is ripping off taxpayers. $84 billion more they got in 2025 than the entire part of Medicare that's called original Medicare. So the government is really pushing you into Medicare Advantage by giving Medicare Advantage plans extra money. And then Medicare Advantage is also making you look sicker than you are so that they can get risk adjustment payments. So it's all totaling to be $84 billion more that Medicare Advantage is getting from taxpayers compared to original Medicare. 0 premiums, they get to offer that because they get all that extra money, right? So they can just say you don't have to pay anything, come on in. And then, but it can be more expensive in the end in out-of-pocket payments, and most people aren't even looking at that. But the guide shows you how that's true. Here's a quote from Dr. Kenneth Williams, CEO of Alliance Healthcare. They don't want about Medicare Advantage. They don't want to reimburse for anything. Deny, deny, deny. They are taking over Medicare, and they are taking advantage of elderly patients. But they are taking over Medicare because Congress wants them to. So again, some of the stats you can know about this. I've already talked about the $84 billion more that they're getting. I've talked about the fact that they're making enrollees look sicker. But that amount of money, that $84 billion more, amounts to them getting about 22% higher payments per enrollee. And they get a per member per month payment from the federal government. And then they have the power to ration care according to what they consider medical necessity. So they're really making out like bandits at both ends, getting more money and then having the power to ration care. 54% of American seniors are enrolled in Medicare Advantage, most of them completely oblivious to the dangers at hand. 70% in Medicare Advantage have 0 premium. And we call this Medicare Disadvantage because we know the truth about Medicare Advantage. And here is one of those reports. Here are the dates of the different reports. The 75% I told you about, the 1% of denials, only 1% of them are appealed. And then here's the appeals process. It's you have to go in front of all of these people and try to get the care that you need. And so only 1% go. Trend number 7, workers pay higher premiums. Here's the scenario. You're 65 years old or older. Your company has fewer than 20 employees. You're still working full time at this company, but because there's fewer than 20 employees, you are forced into Medicare. And unlike retirees that are not working, you still have to pay the payroll tax. And then Medicare charges you more because you're working, and it's called the IRMA. The income-related monthly adjusted amount is almost like they don't actually want you to be working. And you pay that IRMA on both Part B and Part D, and it is significant. Trap number 8, you're on the hook for stays at hospitals and skilled nursing facilities. This is where, this is these days when Medicare pays, they'll pay for a benefit period, which you have to look at the definition for. we got one of the best definition sections in our guide ever. We got definitions from everywhere and put them all in. Medicare pays for 90 days. And then there's increasing cost for you after the 90 days, and Medicare refuses to pay a cent after 150 days. And there are specific rules that determine what a day is, and you can be caught if you don't understand that you are not actually having a day or a paid day. And outpatient versus inpatient is really important. And as I say in the guide, every day you should find out whether you're outpatient or inpatient, no matter what kind of room or place you are in. You have to ask if you're outpatient or inpatient, and then you will know whether you're responsible or Medicare is. But having a Medigap policy can solve almost all of these issues. And you can only get it in original Medicare. Trap number 9, the government recipients are under surveillance. You are a government dependent, so you have no right to privacy anymore. All medical records in any practice of a doctor are impacted because the government says if a doctor sees even one Medicare patient, the government has a right to find out if they have quality care to all their patients. So this is a violation of all your privacy, no matter what age you are, because the government says if there's a Medicare doctor in there, they have access to everybody's medical records. But as a senior, you actually have no right to care. Only approved care is allowed, and all the doctor's decisions are tracked, and they're paid accordingly. And trap number 10 is access to drugs is limited by Part D options. So in Part D, it used to be that all the drugs were in Part B. And then they decided, it was during the Bush administration, they decided to take it and give that whole thing to the health plans. So now the health plans have control over what kind of drugs that you can have. And you do not have the full range of drugs because the Bush administration and the Congress decided to do this. And I talk about the history in there as well. So drug coverage is not individualized. Drug formularies are not comprehensive. You always have to check every year, and even in the middle of the year, did they take it out suddenly, the drug that you need? So the medications are limited. They may change the coverage yearly or mid-year, and the appeals process is intimidating. So here again, if you would like to, because you're sitting there and I don't have any copies, obviously, for you, but you can go to, see our website with a /Medicare, and you can find this, or you can, as sitting there now with your phones, capture the URL through the QR code. And these are just a few pages that you'll find in there. So you can just kind of get a feel of it, right? 12 questions to ask Medicare agents. The Medicare checklist, things that you should be doing, checking on, and prices you can put in there, and the table of contents. And we include medical sharing because some people are staying in medical sharing. They're not doing Part B. And only Samaritan Ministries allows you to stay in there at age 65 if you choose not to go into Medicare. You are not kicked out. That's the only healthcare sharing organization that doesn't kick you out.
Is that Samaritan's Purse or
Samaritan Ministries? Samaritan Healthcare Ministries.
Yes.
Yeah. It has 12 key points, which are really basically, if you don't want to read the whole thing, read these 12 key points. And then I'm going to take one little switch for questions here, just as essentially before I go to questions, is organ donation. Be very, very careful. It's just sort of my, this wasn't asked for in this presentation, but what's happening with organ donation is so concerning that they see that you've got organ donor on your driver's license. They may not even wait long enough to find out if you'd actually require. This is what HHS and Bobby Kennedy found. And then, and so we have this here because the other thing that you don't know is that every state has passed the Uniform Anatomical Gift Act, which says that if they can't find somebody who knows you, they will go down a list. And if there's nobody there to refuse organ donation, the final one, I think, is the coroner, and then they can take your organs. And so they can take your organs without your consent because of the Uniform Anatomical Gift Act, which is explained whoop, whoop, which is explained right there on those little words on the one with the organ donation refusal. But if you carry this little thing with you, which we have online, and you can also order some of these, then you can have it in your purse, in your pocket, in your wallet. And it's there to say, you just don't get to choose me as an organ donor without my consent. And then the last thing is baby DNA. So at the very last, I wasn't going to include this, but at the last minute, essentially, Jan said, will you talk about this? Because of what's happening in your state. And, they're starting to look at our bodies as being very utilitarian. Same thing with organ donation, but also with all of our tissues and our blood. And this is something that we discovered in 2003. We discovered that Minnesota was we discovered that they were keeping the cards of babies after newborn screening and claiming the DNA as state government property. They were selling it, they were sharing it, they were giving it away. And the definition of sell, there's disagreements about that, but they would ask for money per blood spot in order to cover administrative costs, right? So as a result of our work and talking about baby DNA warehousing and this entire campaign, lots less states keep the DNA of babies. And Utah, in really great news, Utah has now the strongest law protecting parents and their right to protect their child's DNA. And it says that after the newborn screening is done, if they haven't got actual consent from the parents, they must discard the blood spots. But like New York, New Jersey, they're keeping them for 20 some years. Michigan is keeping it forever. And so there have been I think we're on our sixth lawsuit around the country regarding the baby DNA issue. The last one is in New Jersey, and it's about the fact that the police came in and got the DNA from the baby DNA cards to try and figure out a criminal, and did it without the parents' consent. So the parents are suing, and it'll probably go all the way up to the Supreme Court. So this is me. And I just want to thank you all for being here. And I really wish that I were there to speak to you. I am going to be speaking at Calvary Chapel in San Jose in just a few weeks. And so, if there's anywhere where you would like to have me speak, and can actually bring me down there, I would be more than happy to do it. But they have asked me to come and talk about Real ID and HIPAA. We are completely funded by individual donors, and we have no government grants. And so you can donate on our website or, through this QR code here. But the last admonition is that there's a lot at stake in the fight for health freedom. And I believe that the reason why they've targeted health and healthcare and COVID and all of that is that they know that by using healthcare, they can take away all freedom. Thank you very much. I think I stopped sharing, right?
No, well, you can't. There you go.
Yeah, okay.
Still recording, right? We still recording?
Yep, we're still recording.
All right, super. So, can you, do I talk? Can you hear if I talk?
I can hear you and I can see everybody else.
All right.
And you all look great.
Super. To everyone here, I've been posting on Telegram and on the Facebook page and my private Facebook page, everything that she was, different links that she has referenced. So you can go there for reference, and we will make this video available in a few weeks as well. Sometime. As soon as Rachel, so I made the mistake by saying we didn't have a tech guy. We really do have a tech guy who does our website and our newsletter for us. And then Rachel, right here, Rachel is such a thing. So thank you, Rachel. She's one that does all of our YouTube up there. Okay, so questions for Twila. Raise your hand. Yeah, I think you're gonna have to talk. Try it.
I already have a real ID. Hold on.
Can you hear her?
I can hear her. Yeah.
So, and it took me 3 tries to get it, so, you know, I hate to go back and change it because it took me so long to get it the first time, but, if I go back to the other, ID, to me, they've got me on in a database already, so I don't see the advantage of going back to the old because I'm already in the system. Am I
Yeah,
right?
so that's a wonderful question. You can hear me, right?
Yeah.
Okay, that's a wonderful question because that is often the question or the first thing that we hear is they've got me already, so why should I go back? So you have to understand what their plan is. So their plan is to get everybody in a real ID, to digitize it, and then to start collecting data about your entire life. So the data that you gave up to get the real ID is a very, very small thing compared to what their plan is, which if you think about a social credit system, like, you know, China was controlling all the Chinese during COVID, and they still are doing it, right? But we actually saw it in action during COVID, how, you know, they were locked in their homes and they couldn't get groceries. There's pictures now of them, you know, laying out on the streets because they can't get in their homes because they've done something bad. It didn't meet the social credit system. So everything being tracked. And then if you realize they want to get to a carbon credit system, so England just did a 4-week study that was just, well, I guess they did it in December, but we just heard about it. And so they actually were putting carbon allowance on different grocery items to say how much this food would be of your carbon allowance. And of course, once this is all digitized, if we allow it to be all digitized, and then if they get a central digital currency, then they will also be able to just cut off your ability to bank, or they'll be able to cut off what you can buy, all of this that you see in China. This is where this is moving. So they want everybody in a real ID because they're building this system, this biometric controlled digital foundation for social credit. And if you think it's okay because it's Trump now, I would disagree because we got Kristi Noem pushing this in a really big way, right? But let's just say Trump is going to go away. What if it's Gavin Newsom? He wants to keep you in his 15-minute cities, and he will know every time you leave. And he will know how far you have traveled so that they can charge you carbon taxes for your use of too much gas if you've gone over. So this whole thing is about building a digital surveillance system, a digital net. And Real ID is the way they're planning to do it in the United States. So they want to move from 44% of IDs and driver's licenses that are not compliant. They want it to be, 100% compliant. And we're saying we want freedom in this country. We're not going to let you do that. And we are going to move it the other direction. So I know you went through trouble, but this is about paying perhaps 30 extra dollars, going back and getting it, and then paying probably 130 to 150, depending if you want the passport book or the passport card, in order to know that you can fly and get into any federal building and to anywhere where they would require that. You have to look at what they want, and they want you in a real ID for their control. So I know what you're saying, but actually, it's the data you have given is a pittance. They don't have you in the database yet, but they will when it's digitized. But they're not planning to digitize the state driver's license. They're planning to digitize the real ID. I hope that is helpful.
Yes, and so Chaffee is very gracious. They are wonderful people down there. And you can transfer back. They understand. They get it because we had a conversation. So Jackson did too. And Jackson did as well. And did it want you to transfer back? I haven't renewed my license anyway. Yeah. I renewed mine and I never had one, but we had a conversation about it. So you just go in and just go ahead and say, I mean, I'm just renewing mine, but I can have. Yes, I don't want it, and they're fine. Jackson, no problem. I don't know about Kate. Anybody had any experience with Kate? You what? No problem with Kate either. So that's good to know. Okay. Another question? Anything else on that? Okay.
So now, if you got the real ID and you have a passport, I got it later, they're totally different, right? So if I have the real ID, but also a couple of years ago, I have a passport that I renewed. So those are still totally different. Just go in and tell me what's your other ID back, and then my passport's okay, correct?
That's correct. Go get your other ID back. And I will tell you a little tiny story. I don't remember what state it happened in, but we're getting these stories back about what it was like to make the switch, right? And so in this one state, I don't remember which one, the DMV agent said, "So you don't want the why? I don't want to be nosy, but why? Why you want to switch back? Because fly and all this kind of stuff." And then she gave some kind of demure kind of answer. She just kind of, fudged. And so then the DMV agent said, "So you don't want the federal ID?" So the DMVs know it's a federal ID. It's not a state ID. It is a federal ID under federal control. And this is the United States of America with 10th Amendment rights, but Real ID is a complete violation of it.
Another question?
I think actually what needs to be realized, this is not a national ID, this is an international ID. And the plan is to do this worldwide, same database, to be shared not only amongst countries, but also commercial entities. So this will be shared worldwide. This is the mark of the beast coming in.
Yeah, so I'm a Christian, so I know well the 666 and such. And I can't say what it is or is not, but what I can say is this is totalitarian control. So Brett Weinstein, how many of you have ever watched Brett Weinstein and the Dark Horse podcast? Have you ever watched him? Such a great guy to listen to. I was at the Freedom Fest and my communication specialist was working on building a little relationship with him during this time because we really wanted to be on his podcast because he's got 500,000 viewers, right? And so the third time she brought me. And so I started answering his question after question after question after question to question. And finally he said, "Okay, you've convinced me. Now, what do you want?" And I said, "Well, you've got a really big podcast. I'd like to be on it." So in the very beginning, if you watch that podcast, he says, "This is one of the rare opportunities where somebody has convinced me that there is something of such importance that I must talk about it." Because he had just thought it was a nothing. Like most people, just think it's like a nothing. Driver's license with a star, big deal, right? And then he's the first person who actually used in an interview the words totalitarian. He goes, "This is a totalitarian system that's being set up," and he can see it. And he's not conservative, but he can see it. So it's really important to actually take action. And I believe it's in the American people. So we have a 4-prong attack on this. We've given a presentation to a whole bunch of Republican AGs, and we're trying to get them to move on it. We have at least 12 states where there are legislators that we're working on bills to either outright repeal conforming with the federal ID or putting in poison pills like, no biometric photos allowed, that sort of thing. And then we have the American people. And amazingly, we now have U.S. Senator Rand Paul. Now, that shouldn't have been amazing, but for a year, we've been trying to capture his attention. And he just came out with the bill called Safeguarding Personal Information Act, and it completely repeals Real ID. Now, he has no co-sponsors, and there is no House bill, but he is the chairman of Homeland Security, which funds the TSA. And he just put it in his newsletter to Kentuckians today. So he has had a tweet. First of all, he's had the bill, then he's had a tweet, and then he's had a press release, and now he has announced it to his own people in Kentucky. And that all gives me some assurance that he is going to move on this and make this public. And this is my hope. I actually would love it if I could, testify, because again, I really do think of all the organizations, we probably have the most information that we could share in a hearing. But we need the public to understand what Real ID is, and they really don't. Most of them don't.
And so we put your information about Senator Rand Paul in last week's newsletter, right?
Right.
So,
Nice.
right. It's in last week's news. I know it's in there, and you can click on the link Maybe we'll put that in again this week. I don't know. We got a lot. Look at your last week's newsletter. If it's not there, let me. Okay. So anyway, sign up for Twila's emails. We've been friends for a long time, so I've been getting a lot of emails from Twila, and I so appreciate. And as a matter of fact, I contacted somebody, Twila, because if we could view your emails, we have an option to view in browser. I can actually connect that to our newsletter, but I share a lot of stuff about you anyway. And then also with regards to the Real ID, if you go to her website, and I put all that on Telegram and Facebook, and do go ahead and register or let them know so that Missouri can turn dark red instead of the light color. So that when people look at that, they see that, oh my gosh, a lot of states are refusing Real IDs. So do that as well. That one to get over.
We need to strengthen the backbones. And while you're walking over there, Jan, I just want to tell you that we have a supporter in North Carolina who heard me on Jimmy Dore, and he is a trucker with a very long semi and a beautiful royal blue cab. Anyway, he said, I want to put information about Real ID on my truck so that everybody that I drive by and in the truck stops and stuff would be able to see it. So just about a week ago, we got decals on his truck, and he drove from North Carolina, and I think he just drove through Phoenix. So we're hoping that that is also spreading the word about the truth about Real ID.
Well, first of all, thank you for your unending support for our freedoms. We appreciate it. And second, when you go to TSA and they ask to take your picture or stand in front of the camera, what's the process if you refuse?
Yeah, let me tell you, that's a very good question. And so if you are paying attention as you get up to that point, you will see that there will be signs about this big that say you can opt out. Now, it really does depend on the TSA agent as to how persnickety they are as to when you tell them you're opting out. So I just had a persnickety one in Minneapolis who I handed him my boarding pass because I knew, because I wasn't taking the photo, he'd want my boarding pass. So I handed him both of them, and he put it in the machine. He put my ID in the machine, and I said, I'm opting out. And he said, you can't opt out because I just put your ID in the machine. I said, no, I'm opting out. He goes, you got to tell me that first. And I said, well, there's nothing that tells me I have to tell you that first. It just says I can opt out, right? He said, you will never be able to do this again. And I just blew him off because I've been to so many airports. And I know that it was Senator Merkley in Oregon that he actually has a bill to stop this whole business. He's a Democrat. And it's a bipartisan bill. And like John Kennedy, right? From Louisiana. Yeah. He's on there too. It's really very bipartisan to shut down these cameras. But because he made such a stink about this on social media, now in the Washington, D.C. airport, they actually have signs about this big, stop signs that say, stop. If you're going to opt out, tell us before you hand us the ID. But I'm here to tell you that I have flown and not had my picture taken like this guy, right? He actually let me through because he can, and because others have before too, but they're trying to be sticklers. So the best thing to do, if you just want to go through without any grief whatsoever, hold on to your ID, say, I'm opting out of the photo, or I'm opting out of that, I'm opting out of the camera, right? And then they will ask you for your ID, and then you can hand over the ID, and then they'll ask you for your boarding pass, and then they're going to scrutinize it like you're likely an evildoer and give you, and just make you feel uncomfortable, but don't feel uncomfortable at all. I don't. And I just wait around for them to do their little thing about getting the little seeing glass out and looking at it very carefully to see if it's really you. But that's all you have to do. And then I do know someone in Minnesota who, as soon as she found out she could opt out, she said, I'm opting out. And the guy said, okay. And then she looked back at the whole line behind her and she said, you know, you can all opt out. She just, and every time she flies, she does this. I'm thinking of getting shirts, right? Everybody wear their shirts, say opt out of the camera because you don't want to train those machines that want, to identify you on the street.
That's a great way to educate, right? Hear that loud voice. Another question? I want to thank you so much for being here, but I'm a daughter that takes care of her father. He's 85 now. I've had him since he was 80. And so I've had to deal with, Medicare and Part D and all different things. And my dad lives with us and I'm his power of attorney and everything, but I also helped. He was a retired farmer. So he farmed until, he farmed until my mother died. And when
Right.
my mother died I ended up with all the machinery. So I finally sold a tractor for him in 2023 and then sold another one in 2024. No one told me that he was going to be hit by Irma. And he was hit by Irma. I guess it's good that I didn't sell him in the same year. But when I
Right.
look at your stuff, will I be able to find things about that too on Irma? What I can do to protect him and safeguard him? Because he has more equipment to sell and I don't know what to do because right now he's getting about $5,000 less in his check from, his monthly social security check. And I don't even have the heart to tell him because he would be so angry.
Yeah. So we don't have it to that detail. We include this thing about income. So it's whatever income is, right? But it's mostly just related to your working because that's really where most people get it. But you can have other income that's really substantial that could impact it, as you are saying. And so I really encourage people to go talk to somebody who is an expert in this, whether it's a financial advisor, a Medicare advisor, but I don't almost think really it's the financial advisor that you should talk to. And,
The
somebody
one
who's
that didn't
really
tell me
independent.
about it. It's
I'm
after
sorry.
it happened. He's the one that didn't tell me about it till after it happened. And I got a letter and he said, oh, yeah, I forgot to tell you about Irma.
So you may or may not have the best financial advisor.
Yeah. Okay. I also, Twila's Jan again, and I have inquired regarding your billboard, refuse real ID.
Yeah.
So it's my understanding to try to work with other groups in our state to try to fund those. I think it's Becky or Rebecca, somebody I'm working with. Anyway, it's quite costly to put up a billboard, if anyone doesn't know. If you have other organizations, I guess, who are asking or inquiring about that, can someone let me know? Or do you have any other details for me about
And
this?
we've had individuals fund them and others, but the interesting thing is that we were thinking it might be a better idea to do Facebook ads rather than billboards. But I am here to tell you it has been a 5-month battle with Facebook to actually they consider them political ads.
Yeah.
And so they have just stonewalled us, put us through all sorts of hoops and still have not, agreed. And so, I feel like, social media is one of the very, very, very best ways for everybody to engage. You all have your own social networks. You all have your own family groups, work groups, um, um, friend groups, all of these, you got churches, you've got, civil committees, civic organizations, you have to pass the word. And this is, one reason for our card. But the easiest thing to do is to say, hey, I'd love to see your ID. What kind of ID do you have? Or what kind of a license do you have? What kind of ID do you have? And they'll say a driver's license. And you can say, well, like a real driver's license or the federal ID. And get people to start pulling out their licenses and then tell them what it is. And then tell them that they have the option to stop what's going on here. this whole move to take away their freedom, their autonomy, their privacy, and building this digital net, through that ID. So it's really about people. We will engage at the others and we will build up opposition through the other mechanisms, and hopefully there will be a hearing in Congress. But what has happened is that they've had 6 or 7 deadlines, and it's all because the people have refused to comply. Now they thought this new thing of, you can't fly on May 7th was going to work. Well, it didn't work. And of course, we're reversing it. And we've got lots of people reversing, it around the country. And now we're going to keep numbers of how many are doing that. And so it's really about us. It's about we, the people, activating and saying, yeah, we won't comply. And even in England, that's what they said. The way we're going to defeat this is just to say we will not comply. And that's what has to happen here.
Alrighty, what time? 1 minute. Okay, so everyone, here's your homework. Go to Twila's website, CCHFreedom.org, and
Yep.
Sign up for her emails so you'll be informed. Search for the Medicare Toolbox and go to under there is forms, I think it was, or not forms. It was something. Anyway, I posted it, and that has a lot of information. And then see what else for homework? Oh, you have your ID changed back to a regular ID. What else homework, Twila? What's the other?
The only thing I would say is about the emails, just so people know, right now we're just sending out 1 email a month. We may increase that to 2 because particularly with Real ID, things are changing and we want to just keep people informed. But the other thing is that if we stuck with the 1 email a month, we would still put out an alert, like when we alerted people to do a public comment against that proposed rule. So we would still put out an alert, but we do not pepper you with email.
Unlike us, we send it once a week.
I have a real quick DNA question.
Yes.
Twila, thank you. Is there a connection at all between area blood banks and the baby DNA or the human DNA capturing that information, like when we give blood through Red Cross or something like that?
Yeah, so I think, it's good for you to look at the fine print. It's just like people who are doing 23andMe, if they would have just looked at the fine print, they would have seen how much their DNA could have been shared. You have to look at the fine print. I've never looked at the fine print of Red Cross. We've really looked at just the genetic issue and the baby DNA issue because they considered newborn DNA, they consider it to be a national treasure. That's the words they call it, as though it was theirs to keep. And as you probably know, the government cannot come and take your DNA, or it would be a felony. I think it'd be a felony. And keep it. They can't unless you're a criminal, but they're keeping it of these children, and these children grow up to be adults, and the government holds their DNA, sharing it, all sorts of things. So I don't know about a connection between Red Cross and the newborn blood spots. I can say that the Mayo Clinic had a really lucrative contract with the state of Minnesota for a while, and they were getting every baby's blood spots and being able to do research on them without parent consent. And with our engagement in the state of Minnesota, that got shut down, but they're still sharing it with other folks.
All right. We just thank you. Big round of applause for Twila.
And thank you to you.
I'm gonna stop sharing, and then we have a thing to draw. Would you draw one, please? Here's our ticket. You guys get your ticket out. Last 3 numbers are 770. Well, there you go. You get the flag to hang on your front porch. There you go. Wonderful. And what else? Prayer.
Am I leaving now, Jan, or?
Well, you can't leave until I close because I don't want to lose the
Okay.
recording. So
Got it. Okay.
we're gonna close in prayer.
Okay.
So hang on with me.
Okay. I'll pray along with.
Oh, yes, and we'll start with the donations, but go ahead, please, Michael.
Dear Lord, we thank you for the gift of life and life everlasting in the Son of Jesus Christ. We thank you for the group of